Hi everyone, I'm Assistant Professor Dr. Thitima Wataneeyawech and Dr. Petharat Onto from Health Science Department, Faculty of Science and Technology, Nakhon Sawan Ratchapat University, Thailand. I would like to present my research. The topic of this research was the Sustainable Aging Health Network in Thailand. The background of this research: the large amount of aging people is increasing all over the world. Aging society will impact aged persons themselves. One aging person had one or more diseases, both communicable and non-communicable disease. The health personnel and network who work related to aging were also impacted from this situation. The philosophy of sustainable by the King Lama IX about the sustainable economy is the most famous in Thailand and taught Thai people how to apply sufficient economic in their life. The sustainable economy can also apply in aging health network. In the area of healthy aging, good health services, good society, and happiness. Thai stakeholders should aware and prepare the appropriate support for developing aging health area. The Sustainable Aging Health Network in Thailand should be explored to solve these problems, and the organizations that work related to aging health can use to apply to their work and make the effective aging health care network together. Research problems. What are the factors related to aging health network? To sustain aging health network in Thailand, the two objectives of this research were to explore factors related to aging health network, and the second is to identify the sustainable aging health network in the community of Thailand. The research framework. The research framework has the three concepts. The first is factor-related aging health and aging health network that both impact sustainable aging health network in Thailand. Research method. The research design was mixed method that used both quantitative and qualitative research design. The population and sample were 50 aging people in the community, selected by purposive sampling as follows criteria: age more than 60 years old, stay in the community more than 6 months, can conversation in Thai, and willing to join this research. And T personnel of health network, selected by main organization who work related to aging. Research finding. The research finding reveal in two aspects. The first one is factor related to aging health, and the second is the sustainable aging health network. The first is the factor related to aging health, revealed in 5 factors as the diagram. Age of aging. It shows that the aging is in the range of 61 to 69 years old for 60%. Only 12% is older than 80 years old. Aging health assessment. Aging assess their health as a good health condition is about 56% and very good at the 18%, and moderate health condition is 26%. Aging health security. We found that the aging use the universal health coverage system, about the 62%, use governance enterprise officer system for 30%, and the social security scheme system and others health insurance for 8%. About the aging health examination, we found that aging have the complete health examination only age and incomplete health examination in 82%. About the aging health service barrier, we found that the most barrier is early morning to get on the queue for 53.3%, and as followed by the long distance from home for 20%, and nobody who bring aging to hospital 15%, and the last one is travel expense cost to hospital for 11.7%. The Sustainable Aging Health Network, the research found that there were many organizations from many ministries. Each ministry has their own criteria and did only their duty, such as the Ministry of Public Health work on health care services, the Ministry of Education work on lifelong education, Ministry of Interior work on community support and aging allowance. The Ministry of Social Development and Human Security work on aging and disability persons. The problem of aging health network found that the separation of working in each sectors, lack of integrated information for aging, few professional health support for disability aging in community, and the few funding support to solve the aging need. The necessary of aging need care network were to set up the participation and build the connection of health networking together. The main organizations found in aging healthcare network were the district and sub-district administrative organization, health organizations such as health promoting hospital, academic organizations such as university and education institutions. Conclusion and discussion. Factors related to aging health. Aging age were mostly at 61 to 79 years old at 88%. That means they were in the young old age. 82% assessed themselves were at the very good, and moderate level. That means they still feel active. All of them had health security system, but very few, only 8% had yearly complete health examination of aging. That was a problem in healthcare services to screen the disease and early detect and get the patient to cure. Aging health service need fast track to see the doctor and quality DAP, physically hospital environment support, such as base area, effective services, and special clinic for aging. The Sustainable Aging Health Network, we try to integrate the factors related to aging health to the concept of the research framework, and also integrated the SDG with the people and partnership with the philosophy of the King Lama IX about the sufficient economic to integrate it to the three main organizations who work related to aging health network in the community. In order to develop the sustainable aging health network, should we integrate personal, funding, and overlap working all together and set the effective sustainable aging health network in community. I would like to say thank you to Research and Development Institutes, Nakhon Sawan Ratchapat University for research funding. Thanks to Faculty of Science and Technology, research team, anyone related, and family support to work hard for this research. For further research, cause these research findings were a part of the total research. The next step is to study other factors, relationships, and integrate health network management for aging and developing quality of life, aging community healthcare activities, health assessment, and health education. Thank you.